Like I never knew where to begin or where to end. And if someone had done this for me when I was in nursing school, it would have been a lot better experience for me. Okay. So let's go. Let me make sure I can see you guys. Okay. Okay, there you go. Hold on a second, guys. I got somebody in my waiting room. Okay, no. All right, so here we go. This is the agenda for today. So I didn't send you guys this copy because I want you guys to actually write. If you write it, I feel like it'll stick. Okay, so I want you guys to actually write this down. I'm going to give you guys some great tips, and then we're going to go through the NCSBN test plan together. All right. All right. So make sure that you guys have your 4-inch 3-ring binder, right? 4-inch 3-ring binder. That's just to make sure that you can put everything where it needs to go. All right. Then you need to get your 15 dividers. Why do you need dividers? What's the point of dividers? Because you want to section everything off. Believe it or not, some of you guys are very strong in these 8 categories. All right, there's 8 client needs area, and many of you are already very strong. A lot of us don't give ourselves a credit. So we're studying information over and over and over and over, and we need to move past it. So how can I officially move past something? How can I feel comfortable saying, okay, I'm going to go to the next section? Get you a binder. All right, get you a binder, get your dividers, throw all of your work in every section. Once you understand the notes, once you understand the material, then you can move on to the next section. Because time is it's not plentiful. I can tell you that. It flies. Before you know it, it's time for the board. All right, so you have management of care. That is going to be your first section in your book, in your binder. Management of care. All right. Management of care, I want you guys to write down. It is the biggest piece of the pie. So a lot of us overlook management of care because we don't think it's important. It's not nursing. It's not hands-on nursing skills. It's not farm, but it is the biggest piece of the pie. Okay, so what do I mean by that? Most times, guys, when I would give a Kaplan review, I would have to give a Kaplan review. And the Kaplan review would have all 8 client needs areas. Some of the students could actually fail one or two of the areas and still pass the adaptive exam. That is because they passed management of care. They murdered it. So because they did so well with management of care, they were able to pass the exam. They may have failed basic care and comfort and a yellow in physiological adaptation. But because they have a green in management of care, those students pass the exam. So I say that because I want you guys to take management of care extremely serious. Okay, so management of care with me, we already did management of care 2 weeks ago. These are some of the worksheets that I distributed. Excuse me. These are some of the sections that we discussed that I felt were very important. Prometrics, clinical skills checklist. I want you guys to write that down. Under management of care, you have to know about RN duties, LPN duties, CNA duties. You have to know what you can and cannot delegate. That's a big part of management of care. How to turn down an assignment. We discussed inappropriate assignments. You have to go through that State Nurse Practice Act. And I know it sounds kind of corny. It's real. It's on the board. ADPI, the nursing process. Case management is huge when it comes to managing care, management of care. Leadership styles. You will get questions on the board on leadership styles. Mass casualty triage principles. Transmission-based precautions. That's your airborne, droplet, contact, and they call it reverse isolation. It's not transmission based. There's nothing being transmitted. It's just an isolation precaution. And cohorting. Can I cohort this client? Conflict resolution is huge. Change of shift report, transfer report, and of course, your emergency triage principles. So you guys with these worksheets, I'll send them to you again. When you get these worksheets from me, file them under management of care. All right, everyone understand that? So when I give you these management of care worksheets, put them in the management of care section in your binder. Throughout, as I find more things, since if you guys are already organized, I can send them to you and tell you, hey, file this under management of care. I think this will help you. Hint, hint, hint. Because think about it, students take the board every day, and students call me every day and tell me exactly what's on the board. So if you guys get yourselves organized, when I send it to you, you'll know, okay, this is a heavy hitter. Let me go ahead and study this. All right, next is safety and infection control. We discussed safety and infection control at length for 2 weeks. We have worksheet part 1, worksheet part 2, 3, and 4. Worksheet part 3, worksheet part 4, that's on YouTube. I put the timestamps to make it very easy for you guys to navigate through those videos. Management of care, safety and infection control. I want you guys to really think about how important that is for the board. National patient safety goals, I'll send you again. And there's a Florida reportable disease condition worksheet, because these reportable diseases are really jamming the students up on the NCLEX. All right. And then you have your CDC vaccinations. In my opinion, guys, vaccinations are the worst thing ever to learn. That schedule is horrific. So what you'll do is I'm going to send you these little flyers. The same little flyers that you get when you go to the hospital or when you go to the clinic. And if you have kids, they give you, you know how they give you those vaccination worksheets or vaccination information sheet or patient education sheets. Put it in real time. Make it real to you. Don't overlook your vaccines, okay? Especially Shigella. Well, don't overlook the infectious disease Shigella. All right. Hepatitis B is intense because there's 5 different hepatitis. Make sure you know your hepatitis B because that deals with us in healthcare. Then I'll send you some flyers, a little worksheet on pediculosis, different contagious diseases. It's an actual worksheet, so it's not just reading. You're going to have to actually fill out some information. It's called active learning exercise. I'll send that to you. And there's a pediatric contagious disease worksheet I'll send to you. I want you guys to file it under safety and infection control. As I get more information that will help you tremendously, like the different restraints, as I take pictures of things to make it more real to you, we're going to file it under its appropriate category. So that's safety and infection. Safety and infection and management of care go hand in hand. It's called a safe and effective care environment. So they put them together on the board. It's a major area. And in my opinion, it's one of the easiest to conquer because it's mostly just memorization. All right, there's only so many ways you can spin Shigella. Okay. All right. Health promotion and maintenance. To me, it is the absolute worst. This is screenings and screenings that no one has really figured out. Okay, if I have breast cancer, do I go at the age of 20? Do I go at the age of 25? Is colon cancer 10 years or is colon cancer 5 years and then 10 years? Okay, so we're going to work it out. So health promotion and maintenance, this is our screening. This is our pediatric or our growth and developmental stages. So let me push this down here. Let me go ahead and. All right. So for health promotion and maintenance, it's growth and developmental stages. Now, some of you had to do those concept maps in school, which is great. This talks about the different stages like physical development, cognitive development, psychosocial development, moral development, age-appropriate activities, vaccination, health screenings, nutrition, and injury prevention. And for every age group. So you have to know for infants, toddlers, preschoolers, school age, adolescent, young adult, middle adult, late adulthood, old, elite old. and pregnancy. So health promotion and maintenance, we are responsible for promoting health for all of these categories. Now, some of us get lucky and, we'll get one or two. I've had students and they have given them nothing but developmental stages because they caught on the machine is the exam is adaptive, so it caught on that the student was not familiar with the developmental stages, and it kept slamming them with health promotion and maintenance. This is a huge part of the board. All right, it's 9%. It's going to throw you off if you don't feel comfortable, so I'm going to send you guys a worksheet. I want you guys to write that down. You're going to get a worksheet from me, and we're going to do an actual session to fill this completely out. We're going to do this together, and then I'm going to upload it to YouTube, and then you can listen to it over and over and over and over again. We're going to go through for every one of these stages. The board wants you to know the physical development, the cognitive development, the psychosocial, the moral, the age appropriate, health promotion, the vaccinations, the health screening, the nutrition, and injury prevention for every developmental stage. You can do the growth and development concept map, or you can do the age group worksheet with me. All right, psychosocial integrity. I want you guys to write down, this is mental health. And I don't want you guys to get so much into the pathophysiology of mental health. That's not where we're going. The board isn't going to slam you on patho when it comes to mental health. The board wants to know about therapeutic communication. All right, where can you find therapeutic communication questions? You can find them in Saunders. All right, if you go to Saunders, if you go to study strategies, therapeutic communication is there. It will help you with your therapeutic communication because sometimes it has nothing to do with pathophysiology. They just want to know that you can communicate appropriately with a person who has schizophrenia, someone who has PTSD. So therapeutic communication it can kind of make you or break you. I had one student who had a lot of therapeutic communication questions. COPD was therapeutic communication. Mental health was therapeutic communication for her. Pharmacological principles was therapeutic communication. So again, psychosocial integrity, that's tab number 4 or divider number 4. It's mental health. We're going to put things like therapeutic communication in that tab. We're going to do some Saunders questions on therapeutic communication under that tab. Now, basic care and comfort, guys, that's your fundamentals class. That's your fundamental class. All the skills that you learn in fundamentals and fundies, that's that. They're going to test you on your skills. Do you know about the NG tube, the Foley insertion, wound care, and most importantly, guys, you have to do a list of sterile, non-asepsis procedures, non-sterile procedures versus sterile procedures. So I'll send you guys a little list so you'll be able to make 2 rows, non-sterile procedures versus sterile procedures. You guys know that when you are suctioning, it's sterile. If you're removing a catheter, it is non-sterile. If you're inserting a catheter, it's sterile. Basic care and comfort, guys, is your skills, everything that we learn in nursing school. Not the things that we see on the floor. The checkoff list, the skills checkoff list. That's what basic care and comfort is. It also deals with lab values, guys. So you should have your sticky notes on your wall. Your lab values should be on sticky notes in your bathroom wall or on your refrigerator. Basic care and comfort has a lot to do with Maslow's hierarchy of needs also. Maslow hierarchy of needs. Who should I care for first? It is huge. So I'll send you guys a little Maslow's hierarchy of needs, and now you know where to file it. So that is basic care and comfort. A lot of skills. This is where your skills. So they'll give you a Foley for a CBI for a patient who has BPH, and then they'll give you the lab values. They'll give you a NG tube insertion, but the patient's hemoglobin is low. So skills for basic care and comfort. Don't let that word basic fool you. Okay, you have to know this is where that skills checkoff comes in. I will send it to you, and then you know where to file it. I will send you the entire skills checklist that you have when you're in nursing school. Now you know where to file it, right? Make sure you get your binder. All right, farm. Everyone loves farm, right? All right, guys, for pharmacology, the medication is a big deal, but I'm going to show you something that's going to blow your mind today. It's not just about knowing the meds. So farm, it is blood transfusions. I'm going to send you guys a worksheet. Blood transfusion, it's mostly the reactions. How do you know this patient is having an adverse reaction? That falls under farm also. So if you've taken the board and you didn't do quite as well as you would like on farm, remember there's more things to farm than just the drugs. Okay? Also, 23 classifications of medications. 23. Believe it or not. So what do I mean by that? I mean there's beta blockers, right? That's one. Calcium channel blockers. That's another one. There are anticoagulants. There are opioids. There's NSAIDs. So you have all of these different classification of meds. 23, I say. The magic number for me is 23. I ain't going to learn them all. So I'm going to do 23 classifications of med. I'm going to pick one medication. For this one, I'm going to learn atenolol. For my anticoagulant, I'm going to learn, they love to throw that heparin. My opioid, I'm going to learn morphine. For my NSAID, I'm going to do ibuprofen. That's what I write. And for my calcium channel blocker, I'll learn because this one kind of confuses me. What's a big one that we use on the floor all the time that I'm going to conquer this year? I would use cardism. Now, there's different ways that you can learn and etc. There's going to be 23 classification. 23. I'm not going to learn every beta blocker. I am not going to learn every calcium channel blocker. I am not going to learn every anticoagulant. Not going to happen. But I can learn one. I can learn 23. I know that for a fact. Now, how am I going to learn it? I would recommend getting your concept maps and looking at videos. All right. I would make sure that I know those 23. If I don't know anything else, I'm going to learn those 23. So let me go over it again. For pharmacological and parenteral therapies, blood transfusions. They love to throw this at you. I'll send you a worksheet. Guess what? Now you know where to file it. Blood transfusion. The adverse reactions are considered medical emergencies. So there's a lot of interventions that we have to do as nurses before we even call the doctor. That's huge. So we have to know about our blood transfusions and to make it very, very doable and not so overwhelming with meds. We're going to find a representative for each classification of med. So beta blocker, atenolol will be our representative. Calcium channel blocker, cardism will be our representative. For our anticoagulants, Coumadin will be our representative. And we're going to learn those. We're going to review those over and over. File it in your farm section. Review those over and over and over again. And also, your antidotes. You have to make a list of your antidotes when it comes to farm. You have to know your antidotes. And your lab values should be in your bathroom, right? On your bathroom wall, on your sticky notes, or on your refrigerator on your sticky notes. That is a major part of giving medication. If I have an order for potassium PO, the first thing I need to do is check the potassium. If I have an order for sodium chloride, the first thing I need to do is check the lab value for sodium. So lab values, make sure you put them on your refrigerator. Get you some sticky notes. You can classify them. You can get very, very, very interesting. All right, sticky notes. You should watch them every single day. Just look at them every single day. Okay, reduction of risk potential I love teaching reduction of risk potential. All right, reduction of risk potential it's simply our diagnostic procedures and therapeutic procedures. So I want you to think about something. Just think of it. Someone told me, my preceptor at Cleveland Clinic, she told me, Caitlin told me when she sat down and took her NCLEX, she put in her mind I'm sitting down to do a safety test. And that's a good way to put it. And especially when it comes to reduction of risk potential. Now, I want you to really look at this. I want you to really take a look at this. Reduction of risk potential. So when we do diagnostic procedures, when we read about diagnostic procedures, when we read about therapeutic procedures, we're so involved in how it works. Like someone got upset with me because I couldn't explain to them the nuclear medicine, like the machine. As a nurse, my scope of practice is to reduce the risk potential if a patient has a order for a nuclear med. So what do I mean by that? If I'm sending my patient a nuclear medicine, it is my job to look at the BUN and creatinine. Are the kidneys functioning? Now, how did I know that? It didn't. I'm not that smart, guys. Trust me, I'm not. I'm struggling. I'm getting older too. I know that it is my responsibility to reduce risk for my client because my textbook told me when I have a patient who is going down for nuclear medicine, if they have to have a nuclear medicine scan, it is my responsibility to check the lab values, especially when it comes to the kidney functions, and make sure that patient doesn't have any allergic reactions. It doesn't, I don't know who made it. I don't know who made the nuclear medicine machine. I can't explain to you what's happening with the machine or if someone is getting radiation therapy, right? I was working at an oncology research clinic. I was at JFK. It was my responsibility to make sure that the patient was aware of taking care of the skin before and after getting radiation therapy. I could not tell you how that patient was going to be positioned. I could not tell you how to turn on that machine. That's not our responsibility. As a nurse, it is our responsibility to reduce the risk. So I have a robust diagnostic procedure and therapeutic procedure list. I will give it to you. I want you guys to start thinking about, I want you to file it. So when we get to this section, you'll have it. But I want you to get into your mind, safety, safety, safety. Reduction of risk means how do I keep my patient safe during a insertion of a Foley? How do I keep my patient safe with a CBI? You don't have to know how to assemble a nuclear medicine machine. You just have to know what you have to review or how do you keep the patient safe before and after. So I made a worksheet for you guys, and now you know where to file it. You're going to file it under reduction of risk potential. Physiological adaptation, guys. Guess what? Isn't this our favorite, most favorite subject? It is med surge. So go ahead and write med surge. So for your med surge tab, I'm gonna make this one bigger. For your med surge tab, I want you to kind of have it organized. Organize your system disorder. Again, guess who made a list for you of all the system disorders? I did, because I don't have a life. All right. So I made a list for you. Now you know where to file it, right? So I'm going to give you neurological disorders, cardiovascular disorders, respiratory disorders, GI disorders, GU, that's your bladder, that's your kidney, musculoskeletal, those are your musculoskeletal or musculoskeletal, how do you say? Neuromusculoskeletal? Am I saying that right? You know, like our diseases like myasthenia gravis, Parkinson's, believe it or not, are those diseases that affect the neuro and the musculoskeletal, because you know the brain controls everything. So if you're having issues neurologically, it can affect your musculoskeletal, like multiple sclerosis. So, and then of course, skin. Skin is very important when it comes to cancer. Cancer. All right. So you have your under physiological adaptation, which is med surge. Start thinking about your neurological disorders that throw you off, not the ones that you're very, very familiar with. Cardiovascular disorders that throw you off. Respiratory, GI, and respiratory, no doubt, you need to know that trach. You need to know trach care. Okay? You have to know trach care and vent alarms. I'll send you a worksheet, and now you know where to file it. All right? Physiological adaptation is med surge. Separate this section: neuro, cardio, respiratory, GI, GU, skeletal, skin. So as during, while you're doing your journey, your NCLEX journey, your NCLEX prep journey is organized. So if you have a neuro issue like a system disorder that you're like, man, I just cannot wrap my head around it, make a note, put it under physiological adaptation neuro so you can always revisit it. All right. So physiological adaptation, that's your med surge. But you're going to focus on system disorders that you just cannot understand. Don't keep reading the exact same system disorders. All right. For skin, I just want to make sure that I put emphasis on burns. Guys, this is very important. Believe it or not, burns is not just a rule of nines. Don't leave it at just, okay, I got the rule of nines, I'm good. No. Once you get your calculation, you have to triage that patient. So you're going to have to classify that patient as a red tag, green tag, yellow tag, black tag. So burns, I have a nice little worksheet for you as well. And now you know where to file it. All right. And don't forget, your cancer is also under skin, because there's a lot of skin cancer that plagues the community. We live in Florida. We sunbathe here. We love the sun. We're addicted to it. So there's a lot of skin cancer. And guess what? They are, hold on one second. There's a lot of cancer. So the Florida Board of Nursing knows, think about it, Florida Board of Nursing, they know that there's a lot of skin cancer. They know that as a first-year nurse, you're going to see this. So you have to know about your skin cancer and your burns. So under skin, put burns. I'll make it neater. Burns, and then put cancer. All right, guys, do me one favor. Just take a little 5-minute break. I have someone who's trying to get in the meeting. Take a 5-minute break, okay? Just a 5-minute break. Just think about what I just went over, okay? All right, guys. So let me just make sure you guys are in. Okay, perfect. All right. So again, skin. Make sure you focus on burns and cancer, the different types of cancer, skin cancer. Uh, okay, that's huge. All right. Now let's count our tabs. Let me see if I'm in order. All right. So the first tab should be management of care. That's your first tab, right? That's number one. Number two, safety and infection control. Right? Three, health promotion and maintenance. I want you guys to start gathering your immunization schedules, your vaccination schedules, anything that you can gather for health promotion and maintenance that pertains to shot records, vaccinations, immunizations. All right. And also, don't forget your car seat. Car seat safety goes here. And you have to know what car seat for every size and age. Well, it's mostly the size. You have to know which car seat. Car seats is on the NCLEX. Okay. Psychosocial integrity. That's number 4. That's your mental health. That's your tab number 4. That's mental health. That's therapeutic communication. All right. And then number 5 is basic care and comfort. That's your fundies class. That's your skills checkoff list. That's your sterile procedures versus non-sterile procedures. Lab values. And of course, the way that we prioritize care is Maslow's hierarchy of needs, airway, breathing, and circulation. Okay, this is what we learned about the AED and CPR. That's basic care and comfort. All right. Pharmacological and parenteral therapies. There's blood transfusion, adverse reactions, 23 classifications of meds. I am not going to learn every medication. So I look at the commonalities that are in every med. And if it's a calcium channel blocker, guess what? I know cardizem very well. If it's an anticoagulant, I know Coumadin front and back. If it's an opioid, I know morphine. I apply my one to whatever I see. I even do it on the floor. Beta blocker, atenolol. Okay, I know atenolol. So if they give me metoprolol, guess what? I'm going to go with atenolol. So don't get defeated and not learn any. Learn 23. There's 23 classifications of medication, and I'm going to send them to you. And now you know where to find them. You also have your medication concept maps. You have videos, guys, of real people taking these medications. And you have to know your antidotes. And your lab values, sticky notes should be in your bathroom. So parenteral therapy, that is tab number 6. Tab number 6, divider number 6. Divider number 7 is reduction of risk potential. That is all your diagnostic procedures. That is all your therapeutic procedures. I'm going to send you a copy. Now you know where to find them. Well, now you know where to file them. So you'll stick them in tab 7, which is reduction of risk potential. And underline reduction of risk, safety. You have to know how to keep the patient safe. And number 8, tab number 8 is our med surge, is our physiological adaptation. So I want you guys to look at that word, physiological, or that Those two words, physiological adaptation. This is a major client needs area. So you have to know how the body is going to adapt. That's your vital signs also, guys. That's your vitals. So let me just go ahead and put that there. Your vitals give you an indication how the body is adapting. So vital signs, okay? And that's for pediatric patient, OB, our adult population. Got to know your vitals. Write them down, stick them in physiological adaptation. If I send them to you, now you know where to file them. All right. So that's tab number 8. All our vital signs, pediatric patient vitals, OB, adult health, vital signs. We got to know them because you're going to get questions. They'll give you something like digoxin for a 4-year-old. And when should you not administer digoxin? So if you don't know the vital signs for a 5-year-old, you're done. All right, so you're going to stick that there. GU, that is your bladder. All right, that's your voiding, that's your urine. So you have to know the system disorders that come, that fall under GU. And that's mainly going to be BPH. Let me just give it to you. BPH is huge. All right, and that Foley, and we'll talk about it more, but those are the major ones. All of this goes under tab 8. So this is our med surge. All right. Now tab 9 is test taking strategies. Test taking strategies actually help, guys. So what is a test taking strategy? What is an NCLEX test taking strategy? You can find a lot. If you go to Kaplan's website, if you just type in Kaplan test taking strategies, you'll see them all. They break them down very well, and it's free. Kaplan has it. That's the best one I've seen. That's free. Now, your Saunders book has test taking strategies. So, on your Saunders book, if you choose study strategies, you'll have 15 test taking strategies approximately. So whenever you just so happen upon test taking strategies, now you know that it should be filed under tab number 9. And test taking strategies is huge. ABC, Maslow's hierarchy of needs, prioritizing. That's your NCLEX test taking strategies tab. All right. If you want an emergency printout, go to Kaplan. They have it there. You're nothing without your test taking strategies. All right, and we're gonna have a session of test taking strategies also. All right, doses calculations. My biggest recommendation is don't get caught up in trying to figure out a doses count. Guys, I used to try to do that. I would try to figure it out. I don't know. I just felt like maybe I'm smart. I have a degree in a 2-year degree in pre-pharmacy. I took my chemistry courses. I can convert. I can figure this thing out. No, don't figure it out. Use the formula. So for doses calculations, I'm going to send you formulas. You have to memorize the formula. You do. You have to memorize the formula. I'm not afraid to go to any nursing facility, any hospital, because I know my formulas. So dosage calculations, the formulas will go under tab 10. So don't worry about doing any dosage calc. Don't worry about solving any problems. For this section, I just want you to write down the formulas and the valid formulas, not these. I don't know where some of, I have no idea where some of these dosage calculation questions even come from. All right. So the best way to get your formulas, you can get it from Saunders. Okay, Saunders has dosage calc. If you go to study and then study and alternate formats, and then fill in the blank. If you choose those under Saunders study, alternate formats, fill in the blank, that's your dosage. There's like 120 or from 102 to 120 approximately. Okay. So those are all of those. I would recommend writing down the formulas. Don't worry about learning anything yet or doing practice problems yet. But if you are ready for it, I will send you some IV flow rates. I will send you a packet on if you need help using the calculator, because a lot of us get mixed up with that calculator. Rounding. If I send you a packet and if you feel like you're ready to conquer it, you know where to file it now. Under dosage calc. Medical emergencies is tab number 11. Okay, as a nurse, guys, when it goes down, we have to know when to step up. It's just, even as a first year nurse, we have to know when we are confronted with a medical emergency. So this is sepsis. These are some things that, like those blood fusion reaction, adverse reactions. So there's going to be a list of medical emergencies. I'm going to send them to you, and I want you to start thinking about, because there's a lot of interventions that you have to perform before you even call the doctor, especially for someone who has a dislodged trach. There's so many things that you have to do as a first year nurse. That's chest tube. What if that chest tube, what if the chest tube becomes dislodged? Okay. So a list of medical emergencies, and I love worksheets, guys. You can print out, they have all these bundles, and I'm not a hater. Okay. They have all these nursing bundles that you can buy. Nurse bundle this, nurse bundle that. So I'm gonna put down my textbook and I'm gonna get another book and read it. Listen, guys, you need to do active learning exercises. You need worksheets. So when I send you a worksheet, don't get upset because if I don't send you the answers. Send me the answers. If you want me to grade it, I'll grade it. But I'm not going to send you the answers because I want you to do it on your own. I can give you, so all of this stuff comes from either your ATI or your textbook. These beautiful bundle packages that they have, and don't get me wrong, it's always easier to see things from a different point of view. I'm all for it, but you have to write. You have to take ownership. You need active learning exercises. So medical emergencies, I will send you active learning exercises so I'll know for sure, okay, you can synthesize and evaluate. It's not just reading. You can break this thing down and put it back together. All right. So medical emergencies. Okay, we have a section 12 for burns, rule of nines. So you'll make a section 12, divider number 12, you'll put your burns, but not just once you conquer the rule of nines, once you conquer it, start thinking about survival potential. Will this patient survive? Okay. Will the patient survive? All right. So that's going to be your burns. Will this patient actually survive? Because that's what the board wants to know. And tab 13, which is the comprehensive health assessment, the dreaded comprehensive health assessment with the cranial nerves and the tuning fork and just everything. All right. The lymph nodes. I'm going to send you what a student gave it to me, and we just been altering it, making it better. So I will send it to you. Guys, you cannot be a safe nurse without knowing your head to toe assessment. That's what we do. We assess. That's what we do. We assess. Okay? We're always assessing this patient because I have to notify the physician if there's a problem. All right. So tab 13 is going to be your health assessment. So if I send you things like pulses or lung sounds or cranial nerves, you know where to file it. Tab 14 is your lab values. We are nothing without our lab values. I recommend that you break them down, like you categorize them. Lab values, like neurological lab values, cardiovascular lab values, respiratory lab values. That's your ABGs. Your ABGs, I do have a packet for you, an ABGs packet and video that will help you if you're having issues with ABGs. This is where you'll file it. Your GI labs, GU, especially your UTIs and things like that, your bacterial infection. And it's good to know if a patient, what type of antibiotic for the infection, especially when it comes to these GI, GU issues. And of course, hematological, especially we deal with a lot of medications that cause adverse effects. Okay, it affects the platelet count, it affects the white blood cell count, it affects the red blood cells. So hematological, you have to know your lab values because you can determine if a patient is having an adverse event from the RBCs, WBCs, hemoglobin, hematocrit, platelets. So categorize your lab values in section 14. I also have a worksheet for that if you would like. Now you know where to file it once I send it to you. And then finally, tab 15. That is your NCSBN test plan. All right. That is your NCSBN test plan. This is that's your NCLEX. The NCLEX is free. The information for the NCLEX review is free online. And let me show you what I mean. We'll end with the NCSBN test plan. Take a little 10-minute break, get yourself together. Now we're gonna go into everything. This is the leader, this is our guide, this is what we use to make sure that we are going to pass the NCLEX. It is the last tab, is tab 15. All right, so take a little 10-minute break. All right, guys, let me know when you're ready. All right, you guys ready? Okay, perfect. All right. All right, so the last tab, the final tab, the most important tab is your NCSBN test plan. So, just to give you guys a little backstory really quick. So, I taught for many, many years. I taught plenty of subjects, did plenty of clinicals, and I would never do an NCLEX review. You know, this people will always ask me, "Oh, why won't you do an NCLEX review?" And I'm like, I don't know where to begin. Like, how do you prepare somebody for the NCLEX? Like, it was just something that I was not going to do. And then when I started working with Alicia Dennis, she's the associate director of HCI. She kind of pointed something. She kind of pointed out the NCSBN to me. We were working together one day, and we're like, wow, the NCLEX is literally right here. If we can just have a school that is focused on the NCLEX. Okay. If we can have a school that the main focus is the NCLEX, we can get a better pass rate. So I started doing an NCLEX review, started to really break down the NCSBN test plan, and I started to share it with students. So now I feel comfortable and telling students how to prepare for the NCLEX. And guess what? It's been in our face this whole time. So this is the website. It's the NCSBN Leading Regulatory Excellence. This is the company. Um, this is the company that controls the NCLEX. This is the company that ensures that we're putting out safe practicing nurses. So another thing, not to be controversial or start any type of drama or talk about anybody, but how did the nurses that did not go to nursing school, how did they pass the NCLEX? Right? That's the biggest question. How in the world did they pass the NCLEX and then function as a nurse on the floor without any errors, no medication errors, nothing? They hadn't gotten into any trouble. Well, I can tell you how they passed the NCLEX without going to the school. All right, can you guys hear me now? Can anyone hear me? Can you hear me now? All right, give me a minute, Give me a minute, guys. Hold on a second. My Zoom group can't hear me. All right, guys. Can you hear me in the chat? In the Zoom meeting? All right, perfect. I don't know what happened. All right. So let's do, oh, it won't let me share. All right, so let's talk about the NCSBN test plan. So that is our bread and butter. So I sent the NCSBN test plan to you guys. I sent the RN and the LPN, but you'll notice that they're very, very similar. Okay. They're pretty much the same, except like the LPNs cannot delegate. No, they cannot. They call it data collection. They can delegate to a CNA, but they're not supposed to do the initial assessment. So there's little things, little issues when it comes to that. All right. And hopefully you guys can, okay, so you guys should still be able to hear me. You guys can see the screen, right? All right. So tab 15, the final tab. And we're going to finish up tomorrow. So this is the final tab, okay? This is the NCSBN test plan. Let me make it a little smaller. All right. The NCSBN test plan is the reason why I decided to do NCLEX reviews. Okay. Because it tells me exactly what I need to teach. So here we have management of care. Tomorrow we're going to break it down. So make sure you have your red pen, and if you can print it out, it'll be great. I sent it to your email. Safety and infection, health promotion and maintenance, psychosocial integrity, basic care and comfort, farm, reduction of risk potential, physiological adaptation. But if you go further down, they even give you the related content that is included. So tomorrow, what we'll do is we'll break it down. So make sure that you have your dividers, make sure you have your binder, make sure you have your sticky notes, make sure you have a red pen, and print this out if you can. Like if you work somewhere and they allow you to print, you don't have to print the entire test plan. You can start from page 19 and print 19 to still a lot, but it's not as much. 19 to 52. All right, 19 to 52. So tomorrow, make sure that you have your tabs ready. Make sure you have your binder ready. And we're going to go over the NCLEX. We're going to discuss the NCLEX in one day. In 2.5 hours, we're going to discuss the NCLEX and the things that you have to focus on when you're studying the NCLEX. So your notes are going to go in each area. Management of care notes go in management of care. Safety and infection will go into safety and infection. Health promotion will go into health promotion, and etc. Because guys, this is your NCLEX. So if you know anyone who is struggling with the NCLEX, you know anyone who's having issues with the NCLEX, this is the foundation. Now, if you look here, it says provide end-of-life care and education to clients. Don't I know that when you take your board, they're not going to say, oh, end of life care, or it's not going to be easy, right? But just imagine if you're prepared for that select all, that apply, or that next gen question, because you have made notes on end of life care, like you have studied it. You can see it in your head because you've made a note of end of life care. So you actually study end of life care as opposed to studying a topic that you'll never ever be responsible for. So this makes sure that you're staying on topic. So there's a little myth about, okay, doing questions or just going bullet point by bullet point and learning these things is not going to make me a good nurse. We'll worry about being a good nurse when we get the nursing license. I'll worry about being a good nurse then. For now, I know this is going to get my license. Okay, so this is tomorrow when we log in at 2:30. We're going to go through the NCLEX. I'm going to go through the entire NCLEX with you, tell you where to find this information, show you some tips on how to study for it, continue setting up our binders, and then next week is a lecture. We'll resume our regular lectures. You see here, perform focus assessment. We're going to talk about that also. So this is your NCLEX. I would recommend printing it. This is your guide. This is what guides you. All right, any questions for me? Any questions? Okay, so no questions. So guys, I recommend that for this afternoon and tomorrow, if you can, please get your binder, please get your dividers, because I have so much information that I can give you, and it won't be overwhelming if you know exactly where to file it. I have a lot of little tips that I've picked up over the years, that I've kept over the years. Okay, so if you know where to file it, it's better.